Iowa has an elderly population that is growing.
Some healthcare workers want to make sure they're doing what they can to care for them. The Iowa Department of Aging data shows Iowa is 9th in the country with the percentage of people 65 and older. Census data reveals about 16% of the state's population is within that older range. KCRG-TV 9's Jill Caspery joins us now from our newsroom. So Jill, what are some hospitals doing differently?
Well, Beth, UnityPoint Health St. Luke's Hospital is part of a growing number of hospitals to take on a special designation. It's called NICH, or Nurses Improving the Care of Healthsystem Elders. The national program focuses on addressing the needs of the older population.
If you can, but a lot of times we ask our patients to do that, right?
This group works day in and day out to care for patients at St. Luke's. Today, though, they took on a new role as the patient.
Are you ready for a bite? Yep. Here you go.
We know that we are having a lot more elders as we move forward because we're living longer. The baby boomers are becoming 65 and older. So to have that magnitude of patients coming to us in the future, really need to focus on the quality of care and how best can we provide for them.
To learn what their patients experience, this crew of technicians took on a number of tasks.
We want you to open a package of crackers, and we want you to open the peanut butter and put the peanut butter on the cracker.
They did each activity with vision, hearing, and touch limitations, with glasses covered in Vaseline, earplugs, and gloves filled with rice. They struggled to put on a shirt, tie their shoes, and open containers.
Nutrition, a lot of times for some elderly, can be an issue because of these very things. It's hard to do, so I'm just not going to eat.
For me, the hearing and the vision was a big thing. I kept seeing things that weren't there, and it was just a smear on my goggles.
It's nice to know that we can take this off. Yeah.
While they had some fun doing it, people here say this opened their eyes to the struggles their patients go through every day. The goal is to make them all better caregivers.
I'm going to have so much more patience, be clear about what I'm saying and what I'm doing with the patient.
Now, hospital leaders say the goal is to continue working with people in the hospital to spread the knowledge from this class to others. Live in the newsroom, Jill Caspery, KCRG-TV 9 News.